when they call our hotline, they have the advantage of talking to an advocate or a nurse, which is kind of a nice option for them to have. And so typically the advocate calls would be something that was more on the emotional side, and maybe for the nursing more of a medical type question.
And we had a profile where you could go to the profile and tell the patient what not to eat that day and what to do that day. Or they were saying, I got this rash all over my body, and what should I do? And you could go to the profile and find out what they had been on. They had this rash, same rash, 6 months or a year ago.
Somebody calls and they'll ask a lot of the. I would say more than not, the calls have been about HIV testing, where they can get testing, if it's free, do I need to make an appointment, that kind of thing. And we have had some calls about housing issues, case management issues, some substance abuse issues.
And you do the same thing, and most of all they talked about hand washing. Hand washing is so important. Wash your hands before you go to the bathroom, and definitely after you use the bathroom. Wash your hands before you eat, after you sneeze, after you touch things and stuff.
I had a caller that was just concerned about transmission, maybe being with someone they knew was positive, and was afraid that maybe they had also become infected with the virus. And how did I know? Sometimes I did have a call where a man was concerned that he was feeling different and wanted to know if he had HIV. And so we talked about that how important testing was, and just talked about why he even thought that he could have become infected. So sometimes if you just try to sort out where people are coming from, can help them feel a little more comfortable about the situation.